Everybody. All right, so I can report that we have 6 new cases, but all of them are in hotel quarantine. So once again, that's very good news. And as I said, we've still got 24 hours to make sure that we can see if there's any community transmission spread from this doctor. Now, of those 6 new cases, none of them are in the Hotel Grand Chancellor. So we have 38 active cases, and we have done 4,376 tests in the past 24 hours. As we said yesterday, there will be 11,000 people vaccinated this week. Now, I can also advise that 272 contacts of the PA doctor have been identified and are being tested. We've also identified 160 people in the PA hospital, and we have had 86 people tested that have come back negative to date. So we'll be getting further information and updates through tomorrow. Now, Dr. Bennett will talk a little bit more about the investigations at the Hotel Grand Chancellor, but one thing we are very concerned about is that we have major concerns now about what is happening in Papua New Guinea. We have been assisting with some tests in Papua New Guinea, and out of the 500 tests that our health authorities have done for Papua New Guinea, 250 have come back positive. So this is a real concern. Papua New Guinea is on the doorstep of the Torres Strait and Queensland, and I hope that I'll be able to speak to the Prime Minister or the Prime Minister's office in the next 24 hours just to talk about our concerns there, have a look at the flights that are coming in, and of course, given our close proximity to Papua New Guinea, I do think it is something that we need to be very serious about. We know that there's a lot of Queenslanders that work or live over in Papua New Guinea, so we are very concerned at the moment. So I'll hand over to Dr. Bennett and then the Health Minister, and then we're happy to take some questions. Thank you.
Thank you, Premier. Good morning, everybody. So, as you know, yesterday, based on the information we had some concerns that there may have been some transmission in the Hotel Grand Chancellor between residents who had spent some time together, different rooms there. Late last night, the whole genomic sequencing confirmed that that is likely the case. So, the whole genomic sequencing is what we call a match between the 3 cases. So one of the first cases in the hotel quarantine, the healthcare worker, and then a subsequent case that was reported 2 days ago at the Hotel Grand Chancellor. We acted yesterday, again, as you know, which is why we put the hotel into lockdown, because we were concerned that might be a possibility, and stopped accepting any return travellers, and also extended the quarantine period for anybody who may have been departing. So from today, clearly there's a lot we don't yet know, and there'll be work going on first to manage the public health risks. So any travellers who had been staying on that floor and any staff working on that floor from the period 5th to the 9th of March, which is where we are currently deeming the risk period, will be asked to go into quarantine and tested. Everybody else who were on other floors, we will also ask just to go and get a test and isolate until they test negative. All staff are tested daily through saliva testing. We have had no positive in staff, so that's very reassuring. But we'll also retest all staff today through the usual gold standard nasal swab testing as well, just to be sure. So that work will be ongoing. There's also a lot of work to understand what the event may have been. We know, we've seen this before, we know that some people are highly infectious, and that is likely the case in this instance, and can transmit the virus through very little exposure. So there's a lot of work undergoing. We now have CCTV footage in that hotel that'll be reviewed. We'll interview various people and try and understand how the transmission event occurred. But in the meantime, the main thing is also to manage the public health risk. So I'm happy to take questions on Hotel Grand Chancellor.
Those people, you said between March 5 and 9 on the same floor, have they since been released? Is that why they have to go to the quarantine?
There have clearly some of those will have been released. Those people have been identified though and contacted. So those that have been released will be quarantined where they are at home. Those that haven't been released will have their stay extended.
How many are there?
There are 106 that have been released since the 9th of March, and there will be probably a further 100, I say, that have been released since the 5th.
Given that this is happening again now at the Hotel Grand Chancellor, should this hotel not be part of the quarantine program?
I don't think we know that at all. I think we've seen it happen in hotels. Certainly New South Wales had their own case yesterday. We've seen it happen in other hotels in other jurisdictions. These are events, not necessarily related to hotels per se. They're events that happen that we need to certainly manage the public health risk and follow up and review and investigate and continue to understand how they occur when we really already have such robust procedures in place.
Has the CCTV shown anything yet?
Not that I'm aware, no. That work will go on today. So we've got
case 1 or case 3 passed to the doctor?
case 1. We're based on the epidemiology. There's nothing certain, but it was case 1 we think that transmitted both to the doctor and case 3
While the case 3 is still
in hotel quarantine at the same time. Correct.
And which floor is it at the hotel?
It was level 1.
Level 1. As the Grand Chancellor, we've seen a vision of guests talking to each other over the balconies, right next to each other and down. Is that a concern, or is that being looked at, how they communicate over the balconies to each other?
Absolutely. So that was, I think you're referring to probably pictures that you saw prior to the last incident. So as you know, a review, the Director General called for a review after that incident. That report's been published and those recommendations have been implemented. That in that instance was not the cause, but clearly that's something we don't want to see happen, and it's not occurring at the moment.
With the review, there was going to be more information come out about the ventilation. Have you received anything on that, and is that a concern with floor 1?
No, my understanding from Hotel Grand Chancellor and the review that did occur was that there aren't concerns around both the ventilation, and that's come from engineering reports.
There are not.
There are not, yeah.
Dr. Bennett, where are the people on the same floor? What were the rooms like? Were they sort of next to each other, sharing balconies? Were they on opposite sides of the corridor?
They're not close. So they're not close. I don't quite know if they're on opposite sides yet. All that work's being undertaken, but they're not close, and neither were they the last incident we had. And so, this virus is. We know that it can be transmitted through opening doors, etc. We've seen that. That's why all those measures around, as you can read in the report, about not having people open doors at the same time, etc., have been implemented. So I think I'm pleased that we've got CCTV footage. I don't think it necessarily will tell us anything. I don't think we can say we'll know for sure, but it's just an extra information that we'll have.
And the time you mentioned the next 24 hours, we sort of understand whether or not that we have any community transmission. How many more tests are waiting to come back?
Well, as far as Hotel Grand Chancellor goes, the majority. So remember, there's 2 incidents here. They are related as a cluster, but they're being managed differently. So from the healthcare worker, we're already seeing test results start to come in, and we can expect many more today. Hotel Grand Chancellor, it's going to take another couple of days. Those people will only be put into quarantine and tested today, or staff will be tested today. So it'll be another couple of days for that actual.
Can you just explain the genomic sequencing, what you learned from that?
So this is, it's probably important to understand, we all know it's the UK variant. That variant's called B117. Even within that variant, there are differences in the genomic sequencing. And so whilst we've seen in Queensland a large number of B117 variants coming into hotel quarantine, they are all slightly different. So when we do whole genomic sequencing, that's the information that tells us, well, actually these particular viruses are matching. And so that's what helps us understand that. It's a very useful tool.
And if there's obviously more positive cases come back from the test today, do you think you'll advise the Premier to put Brisbane back into lockdown?
I mean, what I'll say is that what that tells us, it gives us more of an understanding of where the risk is. Right now, at the moment, we don't perceive there's a risk out in the community. We're doing the public health response now to sort of confirm that. Depending on what we see, that will inform what our advice will be. And I can't preempt that. Certainly with the healthcare worker in the hospital, we haven't seen any positives yet, and that's a good sign. We know in hotel quarantine, staff have already started to be vaccinated, although we know that's 1 dose, so not entirely protective, and they're tested daily with saliva. So again, they're all reassuring elements. And so we'll just have to wait and see and review as the information comes to hand, which is why we've given ourselves 72 hours, so till midday Tuesday.
Dr. Bennett, just as the vaccination rollout continues, should we be at a point where we're ensuring that only doctors that have been vaccinated are dealing directly with COVID patients? Are we at that point yet, and when could we be?
I think the Minister has and we've had a lot of discussion about the vaccination program over the last few days. I do appreciate the interest. I think we all want to get to the end of 1B. At the moment, we're halfway through 1A. And so we don't have such a large health workforce that we can confine. The most important thing is patient care. So if we start restricting, saying who can and can't see patients, and you don't have someone who's vaccinated, that creates a real concern for healthcare. So the priority is really patient care. Now clearly, when we can, we should always ensure that staff who are caring for COVID patients are vaccinated. We can't ensure that yet. We hope to be able to soon. In the meantime, any staff who do care for COVID patients are monitored closely. They understand that they've had contact with a COVID patient. As we saw in this case, the doctor immediately went and got tested when she became symptomatic and didn't go to work. And that's what we've relied on for the last 12 months. So we're not quite where we all want to be yet, and it's going to take some time. And even with one dose, as we saw in New South Wales, we can't assume healthcare workers won't yet get infected, or 2 doses for that matter, although 2 doses is much more reassuring.
How many people are isolated in the Grand Chancellor Hotel currently? How many people are inside?
There are 164, don't quote me exactly on the figure, but around 160 who are there, yeah.
And what will you do with floor 1? Are there people still on there, or are there plans to clear it?
No, there are people still on there, so cleaning is underway. When we talk about a transmission event, it happens at a point in time. So that risk period was the 5th to the 9th. We don't expect anybody on floor 1 is now at any increased risk, particularly as we've had the review into the ventilation and other factors. So again, we'll just reassess as information comes in.
How concerned are you about those people who've since left? So it's, and can I just double check those numbers? 106 since the 9th.
And we'll have figures on how many have left since the 5th tomorrow.
Okay.
Look, concerned enough to say that we think those from level 1 need to go into quarantine and be tested. But we hope for the best. Most of our hotel quarantine procedures, we have a lot of people coming through quarantine. We've seen this is only our 2nd transmission event in hotel quarantine in all that time. So these are all precautionary measures to make sure that we do pick up anyone who also may have been affected.
We've been out in the community for a long time. Those who have left floor 1 since March 9.
Potentially we could have had somebody infectious in the community. We don't think the timing is still such that we're reassured that we can get on top of it and manage that. But there's a potential that we could have, so we'll, again, which is why, as we said, if we get positive tests in, we'll review the circumstances of that person who was positive, and so that we understand if there is any risk to the community.
There's reports out of Britain that this strain is not only just more highly contagious, it's also more deadly. Is that a particular concern now as well?
Yes, I mean, that's always a concern. I've seen those reports. I haven't actually read the articles yet, but that's certainly what those countries that are seeing a high burden of disease are seeing. And, you know, we're in a fortunate position that we're not seeing that, and that's the way we'd like to keep it.
With the PNG situation, has there been any medical evacuations from there?
I think the Premier mentioned this morning one of the cases we had today was a medical evacuation. The rest were all returned travellers.
And those tests that Premier spoke of, are they all done in PNG on behalf of the... The Premier said there had been 500 tests done.
Yeah,
And
they're
250.
done here.
Yeah, some of those are done here. Clearly PNG does their own testing. Queensland has for some time supported PNG with testing samples on behalf of PNG. They're not numbers we report because they're not necessarily, always ours to report.
Back from PNG to be tested,
Correct.
analysed, yeah.
Premier, on PNG, what are you looking at from the Prime Minister? What do you want to see?
I think it's a serious situation up there. So I think we need to look at what is our coordinated response. I think there's an issue there for the federal government. I understand that they are providing some assistance into Papua New Guinea, but maybe we need to look at a vaccine rollout program there as well. It's right on our doorstep, and it is a real risk. And as you know, that's why we're getting our Torres Strait Islanders vaccinated as quickly as possible.
You mentioned restricting flights, potentially.
Well, I think we have to look at the flights. We know that the charter flights from Octetti Mine have already been suspended, but this is the infections in Papua New Guinea are a concern.
Can you say how many of our active cases have come from PNG?
I don't have that. We can get that for you, Janelle. Yeah, but we are seeing more and more. That's why those charter flights were stopped. Yeah.
How's the hospital coping with that influx of patients after COVID last week?
Sorry. Oh, look, I think my understanding is it's okay, but I think sorry.
I might be able to answer.
Yeah, you happy for Rebecca to talk about that?
Thank you. Just in relation to Cairns, we have transported some through the retrieval service from Cairns down to Brisbane. So we're doing that as a matter of course now so that Cairns has the capacity to manage these positive cases. We had 6 positive cases today, 2 of them are from PNG. So as you can see, every week now we're getting positive cases from PNG. And as the Premier said, she'll be talking to the Prime Minister and hoping to talk to the Prime Minister's office over the next 24 hours. I'll be reaching out to Greg Hunt as well. One, to verify that the chartered flights from Octetti Mine are still going to be suspended and what the time frame for that is, because originally it was 2 weeks and we want to see that extended at the moment, and also talk about just the general flights coming in from PNG, because we have been asked to do some work from PNG to do their testing for them. And as the Premier said, 500 tests, 250 positive, so 1 in 2 people. That's quite extraordinary and is quite concerning when they're right on our doorstep, which is why we started the rollout of the vaccine in the Torres Strait last week, and in Sabai Island will be starting today. In relation to the vaccines more broadly, I've heard some of the comments from the opposition today, claiming to know how many doses we will have in the state from tomorrow. What I say is if the Commonwealth are sharing information with Ros Bates and David Crisafulli about the number of vaccines arriving, they might also want to advise them of the ongoing uncertainty about delivery going forward. They might also want to ask the Commonwealth how much they are stockpiling, because while all the focus is on the states of how much they are stockpiling, for 2 reasons. 1, to make sure we've got enough for the second dose, and 2, because we do not have certainty going forward on deliveries. So we know when it comes to Pfizer that from next week, the number of deliveries of the Pfizer vaccine that the Commonwealth has told us to expect in Queensland would not cover the second dose. So if we were not holding on to supply to ensure a second dose, we wouldn't be able to fully vaccinate. I'm very pleased that we're starting to fully vaccinate this week. Secondly, that the delivery numbers are changing very quickly. So a week ago, we were told within sort of 24 hours that the number that we were expecting was going to triple. So we had to very rapidly stand up extra sites to manage this extra vaccine coming in, which we did. We stood up an extra 11 sites. However, we were also told that in getting these extra vaccine doses, that we would have to use them over the next 3 weeks, because we may not be getting any more until they can verify when CSL are going to start delivering the locally made ones. So there's a lot of uncertainty. This isn't a competition as to which state can do more. It's not apples with apples. We have different populations, we have different geographic areas, and Queensland is one of the most geographic diverse states. So the rollout has to be done properly. It is more important to get this right. I don't want anyone getting quadruple the dose that they're supposed to get, or people not being trained properly, or anything else. I want this delivered safely. Ros Bates, as a registered nurse, should be saying thank you to all of our registered nurses who are working in our vaccination clinics today to deliver on this, as opposed to criticising them, why aren't they doing it quick enough and more, because they are working tirelessly to deliver these vaccines. We are exactly on track when we said we'd be delivering and the numbers would be delivering. It's really getting frustrating to hear these criticisms by the opposition that they don't understand that we have no certainty going forward of how much vaccine is going to be arrived here in Queensland. how much we're going to get and when we're going to get it. So we need to make sure you can't set up these clinics, give everyone the vaccine on one day and then shut the clinic back down again and then maybe in 3 weeks' time start it up again because we've got more vaccine. You cannot run a vaccination rollout that way.
The Prime Minister has said that the states that are using up their doses are going to be restocked ahead of other states that are taking a longer time. What do you make of that?
Well, it's a really interesting comment because Greg Hunt has told all the states and territories that they are stockpiling themselves. The Commonwealth is stockpiling so that they've got enough to give to the doctors, to give to the pharmacies, to take out into aged care. Because the Commonwealth have gone into all these aged care facilities and have delivered the vaccine for residents only, and now they're going to have to go back a second time and deliver the vaccine for the staff because they didn't do it at the same time. So they're stockpiling. They're not telling us the numbers, but they are saying that they're holding on to a lot of supply to make sure they've got enough. And also because if a delivery doesn't arrive overseas, if we don't get sign-off on CSL's AstraZeneca when we plan, that they've got enough to pass on into the states. So every state's doing this. The Commonwealth's doing this. Let's stop pointing the finger at everyone and just get on with rolling this vaccine out. The public need to know that this vaccine is going to be there and we're delivering it. That's what we're doing. And we want this to be a success. We need it to be a success. We want people to come forward. So this constant playing each other off about who's done what and how many is not helpful for the rollout. What is most importantly is we are increasing our numbers every day. As we had planned, we are absolutely on track for our 6-week time frame to deliver 1A, and we've started 1B earlier by already going into the Torres Strait Islands. So that's I just want to say thank you to all of the staff and the agencies who are working with us for those deliveries because they are working tirelessly.
The AMA says the Group 1A is too restricted and too small and should include more health workers. What do you think of that?
Well, as I say, we're already moving on 1B, and when we get that guaranteed certainty of AstraZeneca on a weekly basis that we can start rolling out the larger numbers, which is the whole of the health workforce, we will start doing that. But we don't have that certainty. AstraZeneca arrived for the first time a week ago and it was triple the numbers we expected, but then we were told we weren't getting any more for a few weeks. So when we get that certainty, we can look at whether we can speed this process up. But at this stage, we are on track to start when we planned for the health workers 1B. And of course, when it comes to 1A, we are already working through that issue. Any issues about only having staff who are vaccinated to work with COVID patients, that would immediately cut our health workforce in half. That is not safe. That is not sensible. You can't do that. No state's doing that. It is just not sensible and safe for the workforce and for COVID patients to only have half the workforce available and half the quarantine staff and half the border control. Imagine the risk if we suddenly pulled out half of the workforce from hotel quarantine and our hospitals who work with COVID patients because they're not fully vaccinated. We saw yesterday New South Wales has a positive case and that person was vaccinated. So
One each. Sorry. I can report that after speaking with female ministers in my cabinet, we feel very strongly about this, and we will be absolutely showing our support. After cabinet, we'll be going down to Parliament House to show our support for a large number of women, I think right across Australia, who support that more needs to be done to allow women's voices to be heard. And I can also say that the Deputy Premier and the Treasurer will also be attending.
Any restrictions or concerns about the gathering size with COVID?
No, it's outside.
And with PNG, do you want like a border closure or kind of...
Sorry?
With PNG, would you like to see a border closure or do you want to see more Australians get out?
I think we need to see what the plan is for vaccination in Papua New Guinea. I think that's going to be the safest thing. But it is of concern the number of people that are testing positive from Papua New Guinea, and the infection is quite severe in Papua New Guinea.
Has the federal government shared how many vaccines they've done in Queensland?
We've always been sharing how many vaccines we've done, but it's it's a bit hard getting the information out of the Commonwealth.
On JobKeeper,
Yes.
you're renewing your call today. What's your fear are you going to see in a couple of weeks?
Look, I think what we will see in a couple of weeks is a lot of families will see the end of JobKeeper, and that will have a huge impact. We know that industries such as the tourism industry are doing it extremely tough at the moment, and I once again call on the Prime Minister to do more targeted assistance for industries such as the tourism industry that are going to see a huge impact when JobKeeper ends at the end of this month. This is a really serious issue. Once again, we're seeing the federal government not listening to people, not talking to people, and not understanding the real issues.
Premier, the opposition today says it defies belief that the personal email you sent was not discussing government business. Did you breach the ministerial handbook in using the private email?
No, it's been tabled. The Solicitor General has tabled that advice.
Can you explain how you came to the decision before the Solicitor General's advice that the email wasn't government-related business? In order to
I suggest that you read the Solicitor General's advice. Have you read the Solicitor General's advice? Have you read the Solicitor General's advice? No. Okay.
Gotta go.
Thank you, everyone. Thanks.